And Ranking Member Wyden, it's great to be here. Mr. Kennedy, welcome. Welcome to you and to your family. Thank you for meeting with me a few days ago. I'd like to follow up, if I might, with some of the issues that we discussed in my office. I want to talk to you first about the CDC, or the Centers for Disease Control and Prevention. I'm proud of the work that the CDC does, proud that it's located in Georgia with more than 10,000 employees in my state. If confirmed, you would be the cabinet secretary over the CDC. Representing HHS, it's about 29% of the federal budget. CDC is a part of that. Do you agree that the CDC's work is critical to Georgia, critical for our country, and the health of the entire world?
Yes, Senator.
Senator Isaacson, my Republican predecessor, would have agreed with that. Bless his memory. He was a fierce advocate for the CDC, as am I. The CDC is an agency filled with hard-working, dedicated public health servants. They wake up every single day working to keep us safe. I think we don't think often enough about their work, because it's easy not to celebrate the folks who are protecting you from that which doesn't appear because of the work that they're doing. So grateful for the work that the CDC employees do. Some of them are members of my church. I saw that deep commitment firsthand when I visited the CDC just last summer. Mr. Kennedy, you have compared the CDC's work to Nazi death camps. You've compared it to sexual abusers in the Catholic Church. You've also said that many of them belong, this is a direct quote, many of them belong in jail. For me, those are disturbing characterizations of the CDC workers that I know who are trying to keep the American public safe every single day. And as you are presented as the nominee for this position, I need to know, do you stand by those statements that you made in the past, or do you retract those previous statements?
Senator, I don't believe that I ever compared the CDC to Nazi death camps. I support the CDC. My job is not to dismantle or harm the CDC. My job is to empower the scientists, if I'm privileged to be confirmed.
So you retract those statements?
I'm not retracting it. I never said it.
Well, actually, I have a transcript
of me saying that it's a Nazi death camp.
Let me read your words. It says that the institution CDC and the vaccine program, is your description of their work, is more important than the children that it's supposed to protect. And you know, it's the same reason we had a pedophile scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped. That's pretty provocative language. You said in another statement to me, this is like Nazi death camp. I mean, let me finish. I'm just reading your words. I mean, what happened to these kids? 1 in 31 boys in this country, their minds are being robbed from them.
Yeah, I was not comparing the CDC to Nazi death camps. I was comparing the injury rate to our children to other atrocities. And I wouldn't compare, of course, the CDC to Nazi death camps to the extent that any statement that I made has been interpreted that way. Yeah, I don't agree with that. In 2003, the United States Congress Government Oversight Committee ended an over a year investigation of the CDC and used almost that same language. They said that the CDC, just one division, one branch, the Immunization Safety Office, had put institutional self-interest and pharmaceutical profits ahead of the welfare and the health of American children. So that was a conclusion by Congress. And I repeated
Well,
that.
I'm asking you because you're the nominee for HHS. It sounds like you stand by those statements.
Senator, my objective is to support the CDC. There's nothing I'm going to do that is going to harm CDC. I want to make sure that our science is gold standard science, and it's free from that same government oversight investigation committee found that the panels, the ACIP panel within CDC, I think 97% of the people on it had conflicts. I don't believe that that's right. I think we need to end those conflicts and make sure that scientists are doing unobstructed science.
So I want to enter this statement, by the way, into the record without objection.
Without objection.
Last week, the White House gagged HHS and the CDC, preventing them from communicating all important public health information to anyone, including all of our allies, including our allies in the United States and global disease prevention. Can you just answer yes or no, because I'm running out of time? Do you agree with that action?
I was not consulted on it, but that's pretty much standard operating procedure for incoming administration.
So you agree with the action that gagged HHS and CDC from communicating important public health information to the public?
That directive made sure that no public health, that only non-essential travel and mass communications were temporarily suspended pending the confirmation of a new HHS secretary. This is standard operating procedure for every administration.
I get it. I don't think what we've seen over the last several days is standard operation for new administration. I think we're seeing some unprecedented actions, but you agree with it. Last night, members of the CDC, along with other federal employees, were actually invited to resign, these buyouts. And I got text messages and folks I know work from the CDC, for the CDC, that do this important work, who got that note. And it's really important because my experience is that when you send out that kind of note, the folks who resign are the folks who you least likely want to see resign. They got other options. They're gifted folks. They got a lot of expertise. They have options. A lot of them are doing this work because of their patriotism, because of their commitment. Do you agree with the buyouts that were presented to CDC employees just last night?
I agree. At the vast majority of the scientists and experts at CDC are patriots and good government servants.
Can you tell me yes or no?
I don't think anybody's going to resign who's committed to making America healthy again.
Can you just answer yes? Okay, you agree with the buyouts. In our meeting, I asked you to confirm your support for the Affordable Care Act. You also mentioned that you and President Trump want to fix the ACA by making premiums more affordable. Can you answer me yes or no, as I don't have a lot of time? Did you know that tax credits that help families afford health insurance and save Georgians an average of $531 per month per person are set to expire at the end of the year? Did you know that?
I do.
We need to move on.
Do you support Congress extending these tax credits so that Americans can continue to afford health care?
Congress has to make its own decisions about that. My instructions from President Trump.
Mr. Chairman, you're saying I'm running out of time, but I'm having a lot of trouble getting the witness to answer yes or no to a yes or no question.
Well,
and I've got one more question.
You're almost at 9 minutes, sir.
Well, I need him to answer yes or no. Yes or no? Do you
I'm not going
support?
to answer yes or no to a question that's not susceptible to an honest yes or no answer.